everyone. Good morning, everybody. I'm Riddhi from beautiful Spotless Skin team. I'm sure all of you must be keeping good health. To look beautiful and smart at all times in quest of humans, right from the beginning of civilization, view of the common conditions affecting the look and feel of a person is acne, hyper or hypopigmentations, and even hair loss. Out of this, acne is a big concern. Acne is common skin condition that can impact anyone, whether you are a teenager or an adult. This skin complaint is no stranger. Knowing the various types of acne can help you treat the conditions. Acne vulgaris is chronic conditions affecting more than 85% of adolescents and young adults. It is one of the most common diseases affecting humanity and quality of life. It goes beyond just being a skin alignment to various psychological disorder such as depression, anxiety, stress, and low self-confidence. Hence, it is important to know about the holistic treatment approach for this alignment. Despite its prevalence, few people know that June is Acne Awareness Month. Acne Awareness Month was launched to combat the negative stigma surrounding this common skin condition and also to be aware of treatment approach for acne management. So let's connect today with our skin expert Dr. S. Madhuri live from Hyderabad to talk on types of acne and role of sunscreen in acne prone skin. Dr. S. Madhuri is one of the top dermatologists in Hyderabad and all over India. Besides MBBS, she has received specialized training such as DNB and fellowship in dermatosurgery and lasers. She also holds a MD in DVL. She is consultant dermatologist at Apollo Hospital, Hyderabad. With almost a decade of experience, she caters to patients suffering from various dermatologist issues. She specializes and has experts in LHR, hair loss treatment, dermatosurgery, hyperpigmentation treatment, scare management, anti-aging, tattoo removal, clinical dermatology, and many more. She also holds a relevant experience in providing glutathione skin whitening treatment. She is well versed with latest technologies, development, skin hair treatment, advancement, making her one of the most leading dermatologists in Hyderabad. Good morning, doctor. And here we go with the questions. Doctor, first, please let us start with what is acne and what are the types of acne?
Okay. As we've already said, this is one of the most common condition which we encounter in dermatology practice day to day, and it is more common somewhat in teenagers, but age is not a limit for acne. People like adult also may get above 40 years, or the child, sometimes children or newborns also can be affected with acne due to hormone changes like that. So age is not a limit, and at any point of time, 90% of us have suffered from acne, though not severe, at least a bit of acne. Everybody might have experienced in some part of their life. It is so common. So why we need some knowledge about acne is to know some of the facts, to know what to do when you get acne, or what to prevent acne, and some things like that. So what are the different types of acne? So first, what is there are many types of acne. It's never we call acne polymorphous, because it is not always only one type of acne which will be present in the same person. Different types of acne can be present, like few people will have these whiteheads, blackheads. We call them as comedones. So whiteheads means a closed comedone. Blackheads means open comedone. The blackheads will have a little bit of blackness which will be seen. That is nothing but keratin which has blocked the duct. So where from this acne arise? So we have something called pilosebaceous unit. What is that? Nothing but a type of gland which produces this sebum or oiliness. The same place when it gets blocked, you get acne. So acne can be these whiteheads, blackheads, or pustules. Some of them will have pustule ones. Some of them will have bigger hard ones. We call them nodules. Some of them may have much more bigger one. We call them cysts. So these kind of different types of acne are present. So what is the relevance with this types of acne is our treatment varies between which type of acne the patient is suffering. So uh, and how it is caused. So acne can be because of hormonal issues. Yes. Um, no, it can be because of something which we apply also can sometimes aggravate. Sometimes this the oily skin, some of their skin is prone to acne. These are all some of the reasons. And types, as you asked, we'll have this blackheads, whiteheads, or the pus-filled acne, bigger acne, which we call nodules and cysts. Anything can be there.
Doctor, do acne happens to any of the patient, like as in like it doesn't apply to any of the age group, it happens to anyone? Yes, to all the viewers who are connected with us for Spotless Skin and getting know more of the details about Spotless Skin. So, people who have acne and is suffering from acne with any of the age group, you can just write down the questions to us, and Dr. S. Madhuri is going to help us. Yes, we are all waiting for your questions. So, do write us on the Zoom chat. As you all know, doctor had mentioned the symptoms of acne and also blackheads, whiteheads. If you have any of those, please do write us and let us know what you're facing, and doctor will connect with us and let us know that what advices she can help you out with your questionnaires. As you all know that there are the main causes of acne being, as she mentioned, excess oil sebum productions, hair follicles, bacteria, inflations. This all causes acne. To know more about it, we have a Dr. S. Madhuri connected with us. And as we were continuing, Doctor, we were mentioning about the risk factors of acne. It is found in food, like sun, swimming pool, or most commonly heard, like when we go to the
Mm.
swimming pools, it is found more of the major of the males and females going to the swimming pool. They are mostly affected with acne. So what you would like to advise us?
So risk factors, as I told you, a major risk factor is hormonal risk factor like PCOD in females, which can really cause acne because of hormone imbalances which happen. So keeping PCOD under control is the primary treatment in people who have both PCOD and acne. So we give some of the hormone pills or something like that to control both acne and the PCOD in people suffering with PCOD. And second risk factor is the age itself. Some of the teenagers, the age itself is a risk factor for people who are in their, 17, 18, 20, 21, like that. And thirdly, diet. Diet is a really controversial topic. See, there are some of the studies which prove that a little bit of relation is there between these milk products and acne, but nothing of as such to include in the causative factors. So what I tell to patients generally is, suppose you feel anything is, if you're eating anything, you're ending up getting acne, you can avoid that until unless it's not sacrificing your nutritional needs. Till that time it is fine. Otherwise, to every person coming to me with an acne, I will not suggest dietary restriction. So it is telling every person stop everything containing milk, stop everything like cheese or chocolates. It's not possible. So I only tell, if you feel particular food you're ending up getting acne, try to avoid that. That's all. Other than that, it is not generalized for everybody. So in my opinion, dietary restriction is generally not needed in acne. So again, yes, swimming pools or these kind of things, as I told you, something irritation can be from cosmetics, can be from something from outside, like swimming pools or the chemicals used, or these can lead to acne, as I told you, like blocking the ducts and all, they can lead to acne. Not only the swimming pools and these kind of thing, but um, the cosmetics these days, what they're using, they can end up getting acne from cosmetics itself. Even simple moisturizers, sunscreen sometimes can lead to acne in few people.
Mhm. Doctor, as you mentioned that we have acne or people using sunscreen to protect their skin. So,
Mm.
what is the best? So, every individual has different skin, right? So,
Mm.
which sunscreen is feasible to all skin types, and do they need to connect to a dermatologist for a better skin for sunscreen?
Yes. See, if you have clear skin without any acne, or you don't have any skin issues,
Mm.
okay, you can use sunscreen, but like any other sunscreen. But otherwise, the sunscreen is very important to use. We need to use it, but what to use, you should know. So, see, people with dry skin, I give something which has a bit of moisturization along with sunscreen. People with oily skin absolutely do not need any you know um, moisturization that leads to this oily look. So we prefer gel based or matte finishes for people who have oily skin or acne prone skin. So and sunscreen, why is it essential for people with acne is, see, acne, what are the after effects of acne? You may end up getting any pigmentation post acne. So that pigmentation again increases once we expose to sunlight without any sunscreen or anything. So sunscreen is essential for people with acne. And moreover, sometimes what acne preparations we give for treatment or something like that, which they apply over the acne, they also sometimes need sun protection. So it is quite essential to use in acne. And apart from that, what to use, you should know. So gel or matte based, we give for people who have oily skin or acne prone skin. And acne prone skin generally limit to SPF 30, because SPF 50 also you can use, but people with acne, unless otherwise, if you you're going to stay in sun for lot more time like that, confined to SPF 30 if you have a lot of acne. Otherwise, you can anybody can use generally 30 to 50.
Okay. Doctor, it is a myth that acne skin is said to be as dirty skin. Is it true? And what are your views on that?
Dirty skin, in the sense, yeah, it looks oily, so yes. And second thing, in as I discussed about the blackheads and these things now, so blackheads do have this black point type of thing on the pimple. So these kind of thing, and it is not obviously clear, so you'll have all the bumps and all. So not essentially dirty, but not clear.
Okay. Does acne is specific for any season or occurs throughout the year?
Yes, it can occur throughout the year. It's no particular seasonal variation is generally seen. It can occur in any season.
Mhm. That means like a regular putting up a sunscreen is better. It can occur anytime during the year. So
Oh
having
yes.
a regular sunscreen
Mm.
and in your lifestyle is very important.
Very
Okay.
important, very important.
How?
Sunscreen has no season.
Hmm.
Apply it in summer, apply it in rainy season, apply it in
Hmm.
winter. And
Hmm.
these when you go to any outdoor activities like swimming or anything like that, also there are many sunscreens which are really water resistant, you can use during swimming in outdoor swimming pools and all. And people who play or stay more time in the sunlight,
Hmm.
don't forget to reapply every 3 to 4 hours for an effective sun protection.
Doctor, a person suffering from acne and is a swimmer, okay, so it's a swimmer, and due to chlorine, do acne increase, or what are the side effects if the person goes into such kind of outdoor swimming because of chlorine? Do acne increase, or it has other side effects?
Acne, if you're really sensitive to this chlorine and all, can happen. Acne can happen. So the ways to prevent it, immediately after you swim and come, try to wash your face with a good exfoliating face wash, so that any small comedones or these kind of things get exfoliated. So that is how you can protect yourself.
How to prevent acne breakouts?
Acne breakouts prevention is possible with few things. What is that? See, again, anything is not foolproof, but a good skin routine and good hormone balance, these two are required to prevent acne breakouts. A good skin routine is how like applying a good suitable sunscreen and face wash at least 2 to 3 times a day, so that the face is not oily and face is not um favorable for acne. And a nighttime when you're sleeping, a good moisturizer, light moisturizer you can apply and sleep. This skin routine and hormone balance. Suppose you're in females, if your periods are not regular, or if you have any PCOS issue or anything like that, try to get that PCOS under control. An active lifestyle, these kind of things really keep your hormones under control. If hormones are under control, hormonal acne can be prevented. So and don't experiment with a lot of cosmetics when you have acne prone skin. That is one more thing which you should follow to prevent.
Doctor, as you mentioned about the hormonal changes, so there are like individuals who turn old. Does acne occur in them as well?
Yes, adult acne, is very common these days. Adult acne, what do I mean by adult acne? People above 30, above 40 also. So why they are getting acne these days is, yes, because of hormone disturbance is one thing, and because of the, after, especially after COVID, people started using masks and all. So we call it mechanical acne, keeping the mask for more time. It just gives a type of mechanical acne that can also happen in adults. And sometimes what we apply, sometimes we turn irritant to that, and can also lead to acne.
Doctor, is dermocosmetic plays a relevant role in treating acne?
You mean derma cosmetic means the cosmetics which are available for the
Treating
people.
acne.
Like over the counter. That is what you're
Yes.
asking.
Yes.
Over the counter. See, okay, come to salicylic acid. People use salicylic acid very commonly in acne. So it is used from some 0.5 percentage to 2 percentage like that. But what you should limit yourself and what is professional, the demarcation you should know. So higher percentages of these the azelaic acid, these things are also na, some of them you need to use when you're using in whole phase, like serum partner, you should always use in less concentration. And if it is these kind of serums, limit to around 2 to 3 months of usage. Don't go on continue them. Okay, so that is one thing which you should follow.
Doctor, what are the importance of moisturization in acne prone skin?
Yes, moisturization is important to any kind of skin. In fact, okay, in winters it is more needed, but for acne prone skin, the moisturizer should be very light, should be non-comedogenic. See, a moisturizer need is not same for everybody. It differs from person to person, because some person suffers with extreme dryness. We cannot give the same a moisturizer to people who have extreme dry skin and who have acne prone skin or who have normal skin. Everybody, it is different, so it is not one, especially to the face. Body, okay, you can use, unless you're having very dry skin or itchy skin, you can use what are the moisturizers available. But for the face, acne prone skin, the moisturizer should be very light. And people with dry skin, a little bit, more moisturization we need.
Mm. Doctor, according to the individuals, they actually are maybe unable to identify what type of skin they have, because sometimes they have oily skin, sometimes they have dry skin. So, which type of moisturizer should everyone use for acne and acne prone skin and in normal daily activities?
Mm. Daily means like moisturizer, generally if you don't have dry skin na, so morning after your face wash or your bath, when you're going out, you just apply the sunscreen and go. And moisturizer, you can wash your face and apply the moisturizer in the night. So very light, gel or water-based moisturizers for acne-prone skin and oily to normal skin. And this cream formulation, a little bit thicker moisturizers for people who have this dry skin. This way you should differentiate between the moisturizers.
Okay. What are the importance of sunscreen in acne?
Sunscreen in acne is important. First thing, to prevent the darkening. Pimple can lead to the dark spot in many people actually. So that dark spot will again get darkened in sunlight. So to prevent more darkening and to prevent excessive pigment formation, you need a sunscreen. And people with acne, um, in fact, have a very sensitive skin than people without acne. So that irritation itself, needs to be protected from sun. So acne prone skin, you should apply sunscreen. People avoid sunscreen because they feel that they're getting more acne if they apply sunscreen. That only means they're not using right kind of sunscreen. Doesn't mean stop using sunscreen.
Okay. Doctor, what are the factors included for an ideal sunscreen?
Ideal sunscreen should be SPF 30 to 50, should be, non-comedogenic, should be a little bit water and sweat resistant, should include all the spectrum of rays like UVA, UVB, these things, and should not be too much oily or greasy. So these are the ideal sunscreen characteristics which everybody look. So they see, sunscreens basically have three types of bases. One, some of them will have gel based, some of them will have lotion, some of them will have cream based. So lotions are easy to spread, so you can use it on the hands, neck part and all. Cream and gel you can apply to the face. So this is the difference. So lotion sunscreen formulation is suitable for larger body parts like hands and all, especially when you're more time in the outside, you need to protect your hands also. So little bit taking 30-gram cream and trying to spread all over the hands, it is difficult. So lotion is better choice when you're using for larger body parts, hands or legs, these kind of things.
Doctor, it has happened many times where an individual is working in the hot sun. Either they apply the sunscreen n number of times or n number of times the moisturizer. So, like, what is the frequency that a individual should apply the sunscreen?
Every 3 to 4 hours. Every 3 to 4 hours, and the sun is most damaging between 12 to 3. That time you need to be especially careful. Like even what I tell is, when you're going outside at 7:30 or something like that, you go to a walk or jogging, then also you apply. And every 3 to 4 hours you reapply if you're going to stay in the sun. Or else somebody is going to office at 9 o'clock, returning at 4 o'clock, just before starting from your office, anything like that, apply once and come. When you're staying in the office only, no need to repeat every 3 to 4 hours. But when you're staying outside, when you're on the ground, you're playing, you're just in the sun, reapply after 3 to 4 hours. Carry in your bag one sunscreen.
Doctor, how to do layering with sunscreen while using acne treatment?
How to do means, acne is always generally spot treatment. What we give to patients or something, these acne preparations, be it retinoid, be it benzoyl peroxide, be it topical antibiotic, these everything now we do a spot application. So what you can do is, after you wake up, after you bath, just you can do the spot application. And when you're going outside, just wash your face, apply sunscreen. On the top of sunscreen, if you want to do any makeup or something like that, you can do.
So any of the individual applying makeup, applying moisturizer or sunscreen is the benefit part, right?
Yes, it should be included actually. Morning, if you're going outside with makeup, apply sunscreen. On the top of it, apply your makeup. Evening times or night times, you're going, apply the moisturizer, and on the top of it, you can apply your makeups.
Okay, thank you so much, doctor. We have a lot of viewers with a lot of questions. They are your information sessions have been so interactive that we got a lot of viewers with a lot of, and we have Monica Sharma with us. Her question is, are there any specific guidelines or tips for applying sunscreen to acne prone areas such as the face or the back?
Yes, face, as I told you, gel based or matte finish with an SPF 30 is good for people who have a lot of acne. And as I told you, for the back, if you want to apply sunscreen, make it a lotion, not cream or gel, because it is difficult to spread in larger areas. So lotion part you can use in the back. Face, you can use this gel or matte based with around SPF 30.
Doctor, we have Gini Sharma with us, and her question is, can sunscreen help prevent acne scars or post-inflammatory hyperpigmentation?
Yes, post-inflammatory hyperpigmentation, it can certainly not really prevent, but it does help in, not, as I told you, the pigmentation, why the pigmentation forms. So acne itself is a bit of, we call it inflammation. So any inflammation on the skin can lead to pigmentation, not only on acne, anything else also. So acne is also a type of inflammation, so it can lead to pigmentation. And people who pick the acne, or they pinch the acne a lot, that means you are increasing the inflammation. More inflammation, more chance of pigmentation. Again, the pigmentation, see, sun overall also tans you, but especially where you're having the pigmentation, that pigmentation is more deepened, more darkened in sunlight. So it is always essential that a person with acne and this, a pigmentation prone acne, to use a sunscreen in your routine.
Mhm. Doctor, is it something like that where we want to happens that applying more of sunscreen or moisturizer due to pigmentation, do face muscles inflame?
No, 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 no. It doesn't lead to any muscle changes as such. It's just the acne is always limited to the skin,
Mhm.
nothing beneath the skin.
Okay.
As I told you, acne arises from the pilosebaceous duct, we call it pilosebaceous unit, that is located well within the skin.
Mhm.
So nothing in the muscle will never get affected. Don't worry about it.
Okay. Thank you, doctor. We have Shreya Singh. Her question is, are there any potential side effects or risk associated with using sunscreen or acne prone individual?
No, no, no risk factors unless until you use a right sunscreen.
Mhm.
In fact, as I told you, it is better to use sunscreen.
Mhm.
So when I give some acne preparation or something which reduces acne also, I tell, okay, use the sunscreen guaranteely. So it is in fact required, but as I told you, what type of sunscreen you should use is very important.
Mhm. Doctor, we have Suhana, and her question is, can you provide any additional skincare recommendations or tips for managing acne prone skin while using sunscreen?
Yeah. Sunscreen, reapply every 3 to 4 hours, and wash your face at least 2 to 3 times a day. This is very important in acne prone skin. That face wash, you can use something which, exfoliates, like the salicylic acid is very commonly used in many face washes over the counter you get. So that also, but again, the glitch here is salicylic acid sometimes can irritate. So first check in one part of the face whether it is irritating you or not, then only use for whole face, salicylic acid especially. There are certain cleansers. See, some of the people, the acne, the face becomes very very sensitive to them, so salicylic acid really doesn't work for them because it irritates them. So for them, very mild cleansers we provide. So again, you check once the salicylic acid face washes or anything like that, and then you can go ahead.
Okay. Thank you so much, doctor, for sharing the experience. I think Sohana is well versed now with all this green routine you have helped them. And we have Advik Singh. His question is, are there any specific products or ingredients one should look or avoid?
Specific ingredients one should look, yeah. So what are the acne preparations we use in treatment is, it again, the acne treatment is not one. So people with pustules, we prefer topical antibiotic based creams. People who have only the only the blackhead whitehead, we use a different kind of acne preparation. So over the counter, see, there are many serums coming with this niacinamide or azelaic acid. You can use them unless until they are not causing any irritation for you or increasing the acne. Sometimes the bases they use or the concentration may irritate you and you end up getting more acne. If that is happening, don't continue using these over the counter medications. And always when you get this kind of increased acne, not responding to anything, visit a dermatologist. That is the best thing you can do for your skin.
Mhm. Doctor, what advices would you like to give all the viewers of who are suffering from acne skin prone, and what regular routine one should maintain to avoid acne?
Regular routine is a regular face wash 2 to 3 times, sunscreen and moisturization in the night before sleeping. This routine is generally enough for long-term maintenance. So any of these serums or anything is always, as I told you, short-term 2 to 3 months. Long-term, it is always sunscreen, good face wash, and a moisturizer.
All right. Thank you so much, Dr. S. Madhuri, for your valuable time. It has been a very informative session for all our viewers. It is great to hear you. We really look forward for many more such sessions
Yes.
for our viewers in the coming time. Thank you so much, viewers, for your active participation for today's session. And stay connected with our beautiful Spotless Skin page. Bye. Keep going and have a great day ahead.